I started treatment with Dr. Goldberg at the beginning of May this year, 2015, and that was after I had been diagnosed in March for the third time with breast cancer. I had been told by my oncologist that I was now untreatable in terms of conventional oncology. I'd already received 3 of the strongest forms of chemotherapy and very intensive radiation. I'd already had a mastectomy when they found a tumor for the third time in March in my right breast. I'd also been on antibiotics almost non-stop for 8 months to treat an ongoing abscess that hadn't been healed. My entire immune system was run down and compromised. I was very weak, ill, exhausted, stressed, and above all, in a state of extreme anxiety, stress, and fear, believing that the medical system had totally failed me, had not been able to keep me in its care and look after me. So I started treatment with him at the beginning of May, doing ozone therapy, vitamin C by IV, Iscador mistletoe injections, a strict diet. But paired with all of this was the intensive counseling we did as well. I was not sleeping every night for months, from the end of last year till coming to see him. Every night my heart would just race and race and race with fear and anxiety. And we started the counseling process, and at first I would just go into an absolute primal space of fear and shutdown and not being able to express, other than being in fear, how I was feeling. And then through a guided process with Dr. Goldberg, I started being able to physically demonstrate how the stress and the anxiety and the fear was making me feel. And firstly, by having the doctor come from around the table to beside me, that was a very new process. It started feeling like here was a doctor literally on my side, wanting to know how I was feeling, whereas how I was feeling was never part of the interest that the oncologists were taking in my health before. And I'd come to a place where I felt that the stress and anxiety I was feeling was directly linked to my cancer. And Dr. Goldberg was very in tune with that and sympathetic and supportive of that, and helped me and wanted to help me identify and deal with the stress and identify it, bring it out into the open, enact it so that it could become something that I could express and I could interact with and I could engage with. He made it something physical, something handleable. We would go into a situation where he'd ask me to show him how I was feeling from a certain situation, or to talk, and then in that moment of talking, he'd then ask me to enact it. And initially it was incredibly difficult. It was so hard to break through the fear of what does this look like? How does this feel? And slowly we began the process of making me feel safe in his care as a doctor, safe in his care in terms of the medicine he was giving me, and in terms of the therapy, the counseling. And as we went more and more into the primal space of fear and enacting that and exploring it, I was able to connect with not just the cancer that was the source of the fear, but various other emotional, psychological issues that had been driving the state of anxiety and fear within myself always. I have been doing psychological therapy for about 10 years, which had helped me to identify what a lot of my underlying issues were. And so this was the very next step of it. The next phase was to take me out of a place of being stuck into a place of enactment, place of action. And it is now mid-August, and I'm feeling so much stronger, so much more energy. I'm just feeling so much better. I'm feeling more connected to myself. I'm no longer feeling like I'm being driven or controlled by anxiety and fear. When I do feel that racing pulse, that racing heartbeat, or that state of anxiety or fear beginning to overwhelm me, I step back into a process that he has taught me of, what am I feeling? Feel that feeling. Step out of it. Now look at how you were. Look at how you were feeling. What do you need? What does that person need to comfort them, to make them feel safe? And then you step back into the position of experiencing that feeling, as well as being the person who provides your own comfort, your own healing, your own soothing. And I'm building on that. I'm becoming better at it. And I am no longer being controlled by my stress or my anxiety or my fear. I'm now able to interact with those emotions and to comfort myself and to not let them control me, but to, not as yet, I do not control them yet, but I can now mediate them. And that is such a better feeling. That's such a better place to be in. I no longer feel out of control. I no longer feel like my health care is out of control, but that all of these things are now within my control, not as such, that they are within my capacity to not be helpless or powerless. And also that I have a healthcare provider who is here alongside me, and that makes a huge difference. And it's a process I really believe in and feel very confident in continuing with. And I just want to say thank you to Dr. Goldberg for bringing me so far down a path of healing and taking me from a place where I was told that I was untreatable and was facing a limited life expectancy and to prepare myself for the worst, to now where I'm trying to live in positive interaction with each day and not needing to control things so much and not feeling so overwhelmed, but that I can just be in a space of living. So thank you very much, Dr. Goldberg.